All right, so good morning, everybody. I'm Melissa Weiss. I'm the nurse practitioner here in the Greenville office. I am sure we will become very well acquainted after surgery. And thank you to your support people or individuals for showing up this early in the morning. First of all, what we're going to do is we are going to go over everything that's on those little clipboards, okay? If you don't know the answer to something, don't worry about it. We're going to go over it this morning. I usually give everybody time to fill it out. Once you've finished and I see those pens going down, I'll try to move on to the next slide. Group participation is always encouraged, so please feel free to answer questions or ask any questions if you have any as they come up. Please make sure your cell phones are on silent or vibrate, just to make sure we don't get any interruptions. And we'll make sure your support person signed everywhere that's necessary and you signed everywhere that's necessary before we leave this session. Okay, so first question, could you name the surgery you're going to be having? Answer's on there. Okay, so you should know by now that you're going to be having either the sleeve or the bypass. We put up this technical name for it because that's how you're going to see it on your consent form. So the bypass patients are going to be listed as laparoscopic Roux-en-Y divided gastric bypass, possible open, and sleeves are laparoscopic vertical sleeve gastrectomy, possible open. Our intention is to keep everything laparoscopic, meaning those small little incisions on your abdomen. On occasion, it's not very common, but on occasion they may have to do this procedure as an open procedure. It's pretty much the same exact surgery. The only difference is how they go about opening your abdomen. If they convert you to an open procedure, it may require an extra night at the hospital. They may put you in ICU, and that's more for a nurse to patient ratio, so they can keep a closer eye on things. Can anybody tell me who your surgeon is? Okay, so it's either Dr. Scott or Dr. Eichhorn or Dr. Rapp. So Dr. Scott typically sees patients at this location. Dr. Eichhorn sees patients at this location, but also in the Anderson office. Dr. Rapp is mainly in Greenwood, but does come to this office once a week. So those are the three surgeons. I have the advanced practice providers on here too, because you may see one of us or all of us. Christine Coop is typically in the hospital. She assists with the surgeries and she'll be rounding on everybody. I'm sure you will all love her when you meet her. I'm Melissa Weiss and I'm the nurse practitioner. As I said, I'm mainly just here in this office. And Sandra Brewer is our newer physician assistant and she'll be seeing patients in the Anderson location. Can anybody tell me where your incisions are going to be located? Yep. On the abdomen. So it's on the abdominal wall. So you're going to have sutures just underneath, holding that muscle layer together. The skin layer is held together with that surgical glue. Please, please, please do not pick off this surgical glue because I have had some pickers in the past. The glue is there for a reason. We will allow you to shower, lather, rinse, and pat everything dry, but no soaking any tubs or swimming in any pools. We don't want any bacteria going in there causing any type of infection. And we will be looking at these closely when you come for your appointments. Can anybody tell me approximately how long you will stay in the hospital?
1 night.
Yep. Our goal is to keep you in there 1 night. We may hold you a little bit longer depending on how you're doing, okay? So discharge all depends on stable vital signs, meaning your heart rate, blood pressure, respirations. Pain is under good control. You're able to tolerate your fluids and you're ambulating or you're walking routinely, okay? So make sure you have stable vital signs, pain under control, and tolerating fluids if you have that. When you also see your healthcare providers or family members coming in and out of your exam room, please make sure they're washing their hands. We want to make sure everybody stays as healthy as possible during your hospital stay. All right. So will you be allowed to eat or drink the same day after your surgery? Anybody? Yeah. You're going to have be able to drink room temperature water. Reason being is we want to allow those suture lines or stable lines to heal a little bit better. So we're allowing it giving it a little time to rest. Feeling thirsty while you're at the hospital does not mean that you're dehydrated. Everybody will have an IV going. But use this time to sip as much as you can because that's the biggest issue after surgery is dehydration. Can anybody list at least 3 complications that can occur with weight loss surgery?
Death, bleeding, leaks at the connection.
Yep, death, bleeding, leaks. Those are 3 great ones. Heart attack, stroke, failure to lose weight, vitamin deficiencies, malnutrition, death. I mean, there's multiple things that can happen. This is not a complete list, but your surgeon should have already reviewed all this with you when you discuss surgery initially. So make sure you have at least 3 of those listed. Next thing we're going to talk about are blood clots. Blood clots are DVTs, which are blood clots to the lower extremities. PEs are blood clots to the lungs, okay? Main thing, or the best thing you can do, is get out of bed and walk. We will have you walking the same day of surgery, okay? Clots mainly are formed from inactivity, and all surgery patients are at risk for these. Being overweight puts you a little bit higher risk for these blood clots. But again, the best thing you do is get up and walk. Other prevention methods that we do are compression boots or plexi pulses, which I'll show you an image at the next slide. The other thing are heparin or Lovenox shots. It's a blood thinner. The injections are going to go to your abdomen. You may have some bruising at the sites, but that tends to go away with time. Any questions? Okay. This is a picture of what the plexi pulses will look that's connected at the foot of your bed, okay? Those 2 little blue tubes at the top of the screen go connected to those little compression boots. Those compression boots, you're gonna feel a little pressure and relaxation at your lower extremities. And it kind of fools your body to think that you're up and walking, because that's typically what your valves do, pushing blood throughout your system, okay? So keep these on whenever you're in bed. Cute little picture here. To remember to cover your hindsight when you're walking, please, along the hallways. Remember to take off your compression boots. The nurses will show you how to put those on and off. Unplug your IV pole, and again, the nurses are going to show you how to do that. And main thing is cover your hindsight. So you could bring your own bathrobes if it makes you feel a little bit more comfortable. If you don't want to bring your own bathrobe, that's fine. You can use one of those hospital gowns and turn it backwards. You may see some individuals from the support group. You may see some individuals from other group sessions. We don't want you to see somebody that you know and head back to your exam room or hospital room because you don't want somebody to see you the way that you're dressed, okay? Because as I said, we will have you up and walking very routinely after surgery. This is a picture of an incentive spirometer. So I want you to think of this as a little game, okay? And main reason why we're gonna have you doing this is to prevent pneumonia from occurring, okay? So this little yellow part at the bottom, you're gonna think of it as a game where you have to move that little yellow thing up a little bit higher every time you do this breathing apparatus. The nurses will show you how to do this, but the main goal is to extend your lungs, okay, to expand your lungs. We want you to do 10 effective breaths per hour while you're awake and continue these for several weeks after your discharge. We don't want you to go ahead and throw them out once you get home or stuff them in a drawer. Please continue doing this because it's going to help you in the long run. Can anybody tell me, will it be necessary to take your vitamins or supplements after surgery?
Yes.
Yes, absolutely. So you're going to be on these vitamins for life. We do routinely check your levels. Initially, it's going to be for every 6 months for the first 2 years, and then it's going to be yearly after that. Even if you're feeling great, please continue taking your vitamins and supplements. We want you to stay as healthy as possible, okay? What must occur in the hospital before you're allowed to have liquids? That's a good one. So walking is good, but we want to make sure your vital signs are stable. Again, that's heart rate, blood pressure, respirations. We want to make sure you could swallow. So make sure you have vital signs stable, able to swallow, and the doctor writes orders. Once you're discharged, what should you do if you experience any unusual symptoms or pain? Yes, call. Call our office. Our calls typically go to the nurse's line. Reason being is we want you to leave your name, date of birth, exactly what's going on. That way when the nurse calls you back, they could give you a response on exactly what we want you to do. This way also, if they don't know the answer to something, they could ask one of the providers and then give you a good response. Remember, our office does close at noon on Fridays, so if you want to call back that same day, please make sure it's a little bit before noon or early in the day, just so that we could return your call. If you have an emergency and you can't wait for the nurse to call you back, just press 0 and let them know, the front desk know exactly what's going on or that you need to speak to a provider right away. Please reserve the after-hour calls to true emergencies. Like if you need a refill, please wait until the following day because our fellows are on call not only for us but for the whole surgery department. And if we could let them rest a little bit, that would be greatly appreciated between cases. If you're having anything like chest pain, shortness of breath, please feel free to head to the nearest emergency room, but give us a call, a little heads up, letting us know what's going on. That way we're aware of where you're going and we can kind of check up on things and make sure everything's going well, okay? Typically we send everybody to Hillcrest because everybody's trained to treat our patients specifically. On occasions, we may send individuals to Downtown Memorial, but again, it's typically to Hillcrest Hospital. Any questions about that? Okay. How will you know when you could start eating solid foods?
My nutritionist would tell me I can.
Yep. The dietitian is definitely going to tell you, and thank you for responding. You're going to have multiple visits with the dietitians, and they're going to slowly advance your diet. We do this in a timely manner, just to allow, again, that staple line to heal adequately before we start introducing more solid foods. Rules to live by. If it's not on the list, please don't eat it. Okay? If you're really craving something, call the dietitian, review it with them. They may give you a healthier alternative that's within those guidelines for that period. Can anybody tell me how many cc's are in 1 ounce? You could go on 29 point blah, 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 blah. Just say 30, okay? It's easier. So 30 cc's are the same thing as 30 milliliters, which is 1 ounce. Okay, this is important when you start measuring your fluid intakes, because one of those little measuring cups is 1 ounce, and we want you to have one of those every 15 minutes initially while you're awake, for a total of 48 ounces. Some of you are thinking, how difficult could it be for 48 ounces? Again, that's the biggest issue we have is dehydration after surgery. So again, sip, sip, sip as much as you can while you're at the hospital, okay? If you're having any problems with this amount, getting in this amount, please reach out to our office, speak to one of the nurses or dietitians, and they'll help guide you on ways that you could get this in. 1 ounce container is about the size of a, yes, golf ball. And that's approximately the size of a unused stomach or pouch, or the amount of content your unused stomach or pouch will hold. How long will you be a patient of the Weight Management Institute? Yes, for life. And I'm sure everybody has already received the appointments for the next year. If you haven't, I am sure they will give them to you before you leave the hospital, okay? And please just keep all your follow-up appointments. It's mainly to make sure you stay nice and healthy. Is physical exercise optional or is it required? Yep. It's absolutely required. If you don't exercise, you won't achieve your weight loss goals. We will be checking how much physical activity you're doing at every visit, okay? I know this mentioned about getting a gym membership. You don't need a gym membership. Just use your support person as a good motive for encouragement, okay? Get each other out there and exercise. The goal is minimum of 5 days of cardiovascular exercise for a minimum of 30 minutes, okay? Start off slow and gradually work your way up. All right, in the hospital, make sure that when they put that little bracelet on you that your name and date of birth is correct. We're gonna ask you, please do not wear any any makeup, don't wear any jewelry, no false eyelashes or magnetic hair extensions, okay? If you do use a CPAP or a BiPAP, you can bring it to the hospital with you. Just make sure you have a little tag or something on it that has your information. That way if it gets misplaced, they could make sure it gets right back to you. We have sent in some medications to your pharmacy this morning. We want you to go ahead, pick them up, have them on hand. That way when you get out of the hospital, you don't have to worry about rushing anywhere and picking anything up or waiting for the pharmacy to fill it up. Other reason why we want you to pick them up now is we want to know if you're going to have any issues picking up these medications with your pharmacy or insurance. Pain medications is usually either the hydrocodone or the tramadol. Your surgeon will determine which one's the best for you, okay? For nausea, we typically give Zofran for daytime nausea, and Phenergan is typically for nighttime nausea because it tends to make you a little bit groggy or sleepy, okay? PPI is a proton pump inhibitor. Proton pumps are acid pumps that line our stomach. We will have you on omeprazole, okay, for the first 6 months to decrease that acid, help that staple line heal better. It's usually omeprazole 20 milligrams. If you're on 40 milligrams of omeprazole, 40 milligrams of Nexium, pantoprazole, anything of that sort, you will be on just the 20 milligrams of omeprazole after surgery. And some insurance companies will say that you need a prior authorization. We stopped doing those prior authorizations because our nurses were spending a long time on these and they were not getting approved because you can get them over the counter. If you have a Costco's or Sam's membership, go ahead and you could try getting them there. If you need a prescription savings card, we do have some in the back that we are more than happy to give you just to see if that's a little bit less expensive for you. But I cannot stress enough how important it is for you to take one of these every day for the first 6 months, okay? We'll see how you're doing at your 6-month visit and most likely take you off of that medication at that point in time. And then the last one on here is Mycilextrocious for thrush prevention. Those are little lozenges. I've heard everything from I absolutely love them to I absolutely hate them. I'm not exactly sure where you're gonna fall on that spectrum, but please take them as directed, okay? Any questions? So again, pick them up, have them on hand, but leave them at home. You do not have to bring them with you to the hospital, and do not take anything until after you get out of the hospital. Next thing we're going to do is go over your consent forms. So before I hand out the consent forms, please make sure you have reviewed everything on that little clipboard. You've signed everywhere it says patient. Your support person has signed everywhere it says witness. And all your questions are answered in the back because I will be collecting that along with the consent form before you leave, okay? Please do not write anything on these consent forms until I tell you so that we don't have to retype anything out, okay? So can I use yours as an example? Okay. So these are the forms that I have just handed out, okay? What I want you to do is remove the paper clip. First 2 sheets are your consent form. Make sure you have on that clipboard all those questions that we just answered and leave them on the clipboard. I want you to put this consent form on that clipboard because that is the stuff I will be collecting. So the clipboard should have the questions we just answered and then the consent just above. You can hand everything else to your support person because that's for you to take home. Okay? Everybody got it? All right. So again, try not to write anything until I go over the instructions. On the upper right-hand corner, you should see your name and date of birth. Just underneath that, I know you probably need a little magnifying glass to find it, but there's a little check mark where it says Hillcrest Hospital. So everybody should have a little check mark there. Just beneath that, under procedure, it'll say laparoscopic Roux-en-Y divided gastric bypass, possible open, or laparoscopic vertical sleeve gastrectomy, possible open, and any additional surgeries you may be having, okay? Like a hiatal hernia or paraesophageal hernia repair. If you notice there's something wrong in your consent forms, just see me afterwards and I'll make sure it gets corrected, okay? Just underneath that, it should have your surgeon's name. Dr. John Scott, Patricia Eichhorn, or Edward Rapp. Now review that sheet, and way at the bottom, I want you to write your initials, today's date, which is July the 25th, and the time, which is 9:09. When you're done with that, turn to the next sheet. Again, don't write anything on this until I tell you. Upper right-hand corner, you should have your name and date of birth. The next section, you do not have to write anything on it. It just states that everybody is listed as a full code, meaning if anything were to happen to you during surgery, they're going to do all means necessary to resuscitate you. Okay? And I see everybody nodding yes, yes, yes. All right. If you could review that sheet where it says patient or representative, you're going to print your name. Well, first you're going to sign it, and then you're going to print it. Where it says relationship to patient, you're going to write self, and then today's date and time. I will sign as a GHS or Prisma Healthcare witness. When you're finished with these, just raise your clipboards and I will collect them. Thank you. And then I don't want anybody to go anywhere until I review these forms, just to make sure that everything is listed correctly and you filled out everything that needs to be filled out so that you don't have to make an extra trip to the office to correct any forms. Everybody stay in the room also afterwards, or actually the patients stay in the room afterwards. The dietitian will be in just shortly after I'm finished, and they'll tell you if you need any additional diet classes or anything of that sort. When I call out your name, your support person can leave. Did I collect them all? Where's your clipboard? Did they not give? Okay, and everything's on here? Okay. Anybody else? We're done for the morning. So thank you all for showing up and for participating this morning.